What causes joint pain to appear, or from a medical point of view? What's called gonarthrosis or coxarthrosis. So many people reach out, they have problems, and I know many of you even write in the comments of various videos saying like, I have a problem, I have surgery, or I have grade 2, grade 3, or even grade 4 gonarthrosis, and I don't know what to do. That's why in this video I want us to give you the causes first of all. What are the causes? Why so many people have joint problems? And at the end of the video, I'll show you what exercises to do or massage to really improve your joints and not have problems in the future. So my name is Vladimir. By profession, I'm a physical therapist. I've been a massage instructor for over 20 years, and I teach people how to take care of themselves. This is my core profession. Let's start with the causes. What are the most common causes? First and foremost, the number one cause is overexertion. People who stand on their feet all day, or spend all day at the wheel, or sit all day long. Yes, or construction workers. There are many construction workers, for example, who lay tiles and they spend all day on their knees. There are people who work as roofers, who also spend their time on their knees. Another form of overexertion, for example, is obesity. It also falls under the category of overexertion. Therefore, overexertion is one of the most frequent causes, which in turn blocks the knees and the formation of synovial fluid in the joints. A second cause is excessive exposure to cold. Of course, there are no such symptoms, no such diagnosis from a medical point of view, but this is a very big, very common problem. Why? And it's more of a diagnosis from grandmothers, from back in the day, that the legs are chilled legs, a chilled back, a chilled child, or chilled people. But what does it refer to? People who once worked in warehouses, who worked outside in the open air, in markets, in booths, selling coffee outside. So they stand there, it's winter now, they stand in the cold, enduring the cold. And if we consider how many markets there are in every country in the world, and people stand outside all day and endure it, our body is like a sponge. If you put a sponge in water, it sucks up the water. Our body is exactly like that. And that cold isn't absorbed by the muscles, the muscle tissue, but by the bone tissue. I once had a client who was already over 60 and didn't have a single healthy joint in her body. And I asked her, I said, where did you work back then? Where did you work? Because it's clear it's from years of being in the cold. And she tells me that she used to harvest sugar beets during the Soviet era, during the time when she harvested for days on end, weeks on end, standing in the cold. And I'm not talking about staying for half an hour or an hour somewhere in the cold. No, here we're talking about days and years on end. And this cold enters the body into the bone marrow through the feet, and slowly it moves upwards. And in this way, what does it do? First of all, a third cause, yes, thrombosis, meaning the cold from the bones blocks the veins, the blood vessels, the lymphatic vessels. Through this, the joints no longer have microcirculation. Moving upwards, it leads to cystitis, pyelonephritis, it leads to pancreatitis, bronchial issues, and lung colds. Therefore, a bone cold is not about pneumonia or bronchitis. Pneumonia and bronchitis can be treated, but a bone cold itself doesn't just go away like that. As remedies, all thermotherapies work, meaning, for example, the only way for you to see if your cause is indeed a cold is to use cupping. And when you apply the cup, very often when you put it on, just like this glass, I don't know how well it shows on video, but how it sweats, that's exactly how many cups sweat. And for many people, when you place them on the lower back, the upper back, or even the abdomen, on the upper abdomen, the lower abdomen, and sometimes we can even place the cups. If we clearly have arthrosis in the legs, we put them even on the legs, around the joints and along the legs. And then what do the cups actually do? First of all, they absorb the cold, which I'm sure very few people have told you about. The fourth cause, since I said the third is thrombosis, is a deficiency of microelements, especially fat-based ones. Fats participate in the formation of synovial fluid, right? So basically, the fifth and one of the biggest causes is the fluid and its depletion in the lower limb joints. If we look at the sixth cause, the gallbladder, which I'm sure very few people have heard of, what do we look at? At the gallbladder meridian. I know you've heard of terms like meridian. They were written about thousands of years ago. And if we look at the gallbladder meridian description online, we'll see it's responsible for joint pain and synovial fluid formation in the lower limbs. Why? Because the gallbladder meridian is positioned, look, on the side of the thigh, the calf and thigh, especially the lower calf, and it runs along the side and goes up the lateral part of the calf and the thigh. That is why synovial fluid is essentially formed by the gallbladder through the production of bile, and this is actually considered to be one of the primary reasons. So those of you who, for example, have knee or hip arthrosis, tell me, you can write in the comments. Do you have bloating, gas, constipation, or headaches in your temples? Because for many of you who already have grade 1 or even grade 3 or 4 gonarthrosis, do you still have your gallbladder or not? And you'll see that actually many do. So write down there in the comments, you'll overlap these 5 or 6 main causes I've listed, and you'll see that practically all these moments have been in our lives. Consequently, we can't succeed until we remove the causes, like the cold, until we replenish the body with microelements and eliminate the overloads. If it's about extra weight, we lose it. If we don't clear the thrombosis, right, and restore microcirculation in the legs, the knees will never recover. What many of us do, people usually, if they have a knee problem, they want to fix the knee and nothing else matters to them, which in my opinion is not correct. Initially, we must remove the cause. So if we find this cause, right, the overloads and the pressure, all the pressure goes when the whole pelvis rotates forward, practically all the pressure goes on the knee, on the hip, and on the knee, and on the ankles, right, meaning the foot. Understanding what the cause is, the main reason, reducing that reason, that is already the first step in unblocking and helping us and solving our problem. The second thing we need to do is to perform some simple exercises. In grade 1 gonarthrosis, the fluid in the joint just decreases and pain simply begins and the range of motion is limited, right? Meaning the heel basically, when we flex it, it practically doesn't reach all the way to the buttock. Right, so that is practically the first symptom. At grade 2, this is for grade 1 and 2. 3 and 4, the articular cartilage is already worn down and the joint rubs bone on bone. That's why doctors most often resort to surgical interventions and prosthetics. And I'm sure many of you listening to this video already have a prosthesis, already have grade 3 or 4, and are already in this advanced situation. One of the reasons it doesn't heal is because there's an inflammatory process there in the joint, meaning all the tissues, the joint capsule is inflamed, and this inflammation prevents synovial fluid from forming in the joint. In advanced cases, when it's grade 3 or 4, sometimes creams or medications are needed around the joint to remove inflammation from all the surrounding tissue, right, of the joint, and then slowly, once the inflammation and pain are gone, slowly move on to the exercises I'm about to show you. So the first exercise I recommend, first of all, find 2 supports, right, 2 chairs, 2 tables, 2 supports to steady yourself. This primarily applies to those with prosthetics, those with grade 3 or grade 4 gonarthrosis, because they already need support. They can't stay in this position on their own, for example, and the degree of arthrosis refers to how close your buttock gets to your heel. Right? For example, for people with gonarthrosis, the buttock doesn't reach the heel. For them, the degree, for example, grade 4, look, this is it, right? While grade 3 is about like this. Grade 2 is about here, right? You see it's about a palm's width. Grade 1, right? Grade 1 is around here. Ideally, right? So I'm going to turn my back to you. Ideally, your buttocks should touch the floor or whatever surface you're on, with your toes pointing in and heels out. So your buttocks fit between your heels in this position. Because this is the correct ergonomic position, that's why we position the toes inward and heels outward. And if needed, spread the heels a bit, but don't spread the knees, as many people do, which isn't right. Initially, your toes are on a hard surface, which isn't comfortable. You can use something soft, even a bed, if you have something to lean on. And so from this position, we slowly start to lean back on our hands as much as we can. For example, at first you can stay in this position, okay? Let me show you from the side to make it clearer. We can stay in this position, then we stand back up, right? We rest for a bit, then lean back again, lowering our back as far as we can endure. Hold it as long as possible, then stand back up. Right, then we go down, down, down again. Hold it again as long as you can, then stand back up, okay? But when we have 2 supports, we hold on with our hands and support part of our weight that way. So what's happening here? When we sit on our legs, the microcirculation in the legs stops. When we stand up, we release the microcirculation, and that's how we create pressure. And when we stand up, we release that pressure. In this way, we pump and clear blockages, improving microcirculation to the legs and knees. This opens the joint capsule, stretches the muscles and joints, and consequently synovial fluid begins to form and microcirculation starts up. Many of you will feel pain not just in your knees. You'll feel the most intense pain in your feet, the foot joints. By the way, many people also have osteoarthritis here. Others will feel significant pain here or higher up, depending on your specific issue and its location. So try to do this exercise for at least 5 to 7 minutes a day until you can sit all the way down. Those who can already sit like this without using their hands can start on a soft surface right away, okay? Now let me show you the next step. For those with stage 1 or 2, they don't need support for this position anymore. But in that case, what do? We see how far the hand reaches on the table, right? I mean, if the hand reaches, many people can't even reach the table with their hands. In that case, you still need support. If you can reach the table even a little, that's already good. Slowly lean back on your hands, then stand up again, rest, relax, and then go back down. Stay down as long as you can, 10, 15, 20 seconds or a minute, then stand up for a minute to rest and release the pressure. Gradually, you'll be able to bend your elbows and go down to them, then stand back up again. Stay down for a minute, up for a minute, for 5 to 7 minutes a day. And slowly you'll find that you can't truly clear lower limb osteoarthritis until your shoulder blades can touch the table, like in this example here, just like this. But only when you reach this point, you will never have any problems with your joints. So if you have this flexibility, it means you're doing great. Congratulations. And these are the reasons why and the incentive for you to do this constantly. But if you maintain this, you won't have joint problems. That is, unless you've had a trauma, surgery, or some kind of mechanical injury. Otherwise, there shouldn't be a reason, fundamentally. So try to do this specific exercise and it will help you a lot. The second exercise is from a seated position. Basically, people with lower limb issues sit all day, right? Because they have constant joint pain. They're always looking for and needing to sit down. And we sit everywhere. When we're cooking, when we go to the bus stop, when we're working. But practically, we look for sedentary professions. Consequently, when you sit, the vast majority sit like this, or they sit like that. And that's the usual position. What I'm suggesting is try to, when you have the time and are free, take your leg. I understand that none of you will initially be able to do, for example, this. Yes, for you it's a very complicated position. So what I recommend is grab your foot by the laces, yes, take your leg slowly and lift it up. You can initially put it on something, on a support, even if you can't, because I know for many with knee osteoarthritis, it's very problematic. So take it with both hands and hold it like this and slowly, slowly try to bring it up into this position. If you've already brought it into this position, hold it for a minute or two, put it down and slowly bring this one up. And you can cook, eat, you can do anything, The more you stay in this position daily, the better it is. Once you've brought it up easily, into this position, what do? We lean forward, yes, look. We lean forward, keep the back straight and lean forward, yes, with a straight back and try to bring your nose to your foot. Ideally, it's when the leg, I don't know if you have kids who can put their leg over their head. Well, I can't. That's the ideal. The norm is when we can at least reach easily with the heel. If we maintain this position, it's very good when you already bring it up and can easily lean forward. And this way you basically stretch the lateral muscles and exactly the gallbladder meridian, which we told you is positioned laterally. So sitting in this position and leaning forward and look, one knee relative to the other, because those with knee osteoarthritis, their position is like this. You see how close their knees are and they can't even lean forward. Yes, so ideally, when you start working on this, move to the edge of the chair, lean forward, back straight, and try to push the knee down as much as possible. And try it out. You'll see everyone has their own level depending on whether you have grade 1 or grade 2. Those of you with grade 3 or 4 need to understand what level you need to reach. This is the ideal. And when you reach exactly this position and maintain it throughout your life, or if you're at the start of the process, try and you can't, but try to find time to do it every day for at least half a year. And you'll see that if you do this, you'll feel good and you'll have results. Alongside this, don't forget the other causes. The fact that you need to unblock your gallbladder. As I said, the gallbladder's function is to form joint fluid. From a non-traditional perspective, trace elements, yes, diet, detox, cleaning the intestines. Yes, it's all a very important process because digestion and peristalsis matter a lot. I'll make another video about the gallbladder, how to unblock it, where you'll see and understand that this is the main problem. And this way, you'll be able to unblock, help yourself, and you won't need doctors for interventions. If you already have knee or hip interventions, we always try to help the body wherever we can to normalize it, improve it, and support it in its current state and position. For example, a very good massage technique is when we simply tap our legs. Look, if we have knee pain, this is called dynamic strike massage, right where it hurts. Try to do about 10 or 20 strikes without pain, up to the point of pain. Then move lower, another 10 or 20, then lower still. And this way you'll slowly see how you unblock and start microcirculation and the results you get. So if you like this video, share it so all people with problems can see it. Or maybe some of your friends or relatives have knee arthrosis and don't know what to do. Subscribe to the page to see the rest of the videos about the gallbladder, liver, pancreas, so each of us can be healthy, stay healthy, and have the health we desire. Good luck and see you in the next video.